People who have arrhythmia, sometimes, you can have symptoms, or some people doesn't feel anything, So some people, what's the symptom of arrhythmia? Normally people may have like some palpitation, they feel like their heart skipping, they feel like their heart beating fast, sometimes they feel short of breath, sometimes they feel lightheadedness, dizziness, sometimes they fainted. That's all the symptoms. Some people doesn't have symptoms. They just come in for the routine checkup and we found that they have a regular heartbeat on the EKG, on the physical exam. What's the normal diagnosis? If people come in with abnormal heartbeat, or we detect that they have abnormal irregular heartbeat on the EKG, normally we check their blood just to make sure that their blood test is okay in terms of they're not anemic, their electrolyte is normal, not imbalanced. We check, make sure that their thyroid function is okay, not too much function of the thyroid or too low function of the thyroid gland, which can cause also fast and slow heart rate respectively. And also after we check all the blood tests, and if everything is fine, then we, as a normal routine medical exam, that you have to ask the history and to see that they take any medication that can cause an abnormal heartbeat too, because some medication can cause the heart rate to go up faster. Some such as people who have asthma or something like that, they use the inhaler. Sometimes you can make the heart rate faster than normal. Some people take medications to treat the high blood pressure, or the heart rate can be slow because some medication to treat hypertension causes slow heart rate, such as beta blocker or calcium channel blocker. And with all the history, if you cut all the medication and you do the blood test and make sure that they don't have any abnormal electrolytes or thyroid function, then the test, normally we do the EKG just to make sure that you will see roughly how electricity of the heart is in 12 positions. You look into every different 12 angle from the test and see that is there any abnormal electrical issue or not. Sometimes you have to do echocardiogram, which is the ultrasound of the heart, to see structure of the heart, to see is there any valvular problem, is there any evidence of weak heart, the lower chamber of the heart is weak or not. Some people you have to do the stress test to bring up the irregular heartbeat. Some people if they have symptoms like not frequent, they have it like they said couple of times a day, then they might you might not see it when you do the EKG at exactly time then they come to visit you. So you may have to put them on we call it Holter monitor, which is the small machine that has a 3-wire attached to you, and you just carry it, and as an outpatient you go out, do everything that you normally do, and you come in and it will record every single heartbeat, and then we try to correlate with the symptom and see that they have any abnormal heartbeat or not. And if it's not happen frequently in terms of the palpitations, sometimes you give them, we call event monitor, that's like small device like a cell phone that you can carry for months, and if they have symptoms they can just trigger it and put it against their chest. It will record that is there any irregular heartbeats or not. Sometimes if it happens once a year and you really think that it's really arrhythmia or something that you think it might be dangerous, like people pass out 2-3 times a year, which is sometimes people pass out, they cannot use the machine, right? So you might have to do the small implantation of, we call loop recorder, something that you can implant and keep for a year or two, and every time they have symptoms they can come in and you just connect it with the machine and interrogate the device, and sometimes it will reveal that people have complete heart block, which is slow heart rate, or their heartbeat just stop or not. That's the reason of sometimes people fainted. So all that test can be done, and then when you find out what type of arrhythmia they have, the treatment is also different.